On today's episode of Getting Real with Goldie, I want to talk to you about getting better. I'd like to be positive today because I'm in a good mood. And also, as a therapist, my role is to work myself out of a job because I will never be unemployed. So the getting better process. Usually people come to therapy because there is a preceding event, right? Or a crisis situation or something that leads you into my office or any therapist's office. And that's great. And sometimes I will tell my clients that when we stir up garbage, sometimes it stinks. So once the kind of crisis has resolved and we get to therapy as usual, ironically, it can actually suck getting better because it can also feel really sad when we realize how much we've missed out on, the negative self-talk that's impacted us, how badly certain people have failed us, right? Somebody, you think they're great and they actually suck. And what the younger versions of ourselves needed and deserved. And so healthy healing can involve healthy grieving. And being able to do that with your therapist and know that it is completely normal and part of the process can actually be really cathartic and helpful. Additionally, insurance companies can and do dictate treatment. So unfortunately, you have to meet medical necessity for therapy if you are seeking it when using your insurance. Some people do self-pay, right? Because they don't want insurance dictating their treatment. And that's also an option that some people have if they can afford it. Although I don't think that therapy should be a privilege. I think it should be something that everybody does if they want it. So what does it mean to get better? If you come into my office, for example, and we're working on treatment plans, right? A structured goal that we're setting for you to know when it's time to go. When people start to function better outside of sessions, there's no more crisis, there's no more treatment interfering behavior, they're taking care of themselves, they're communicating effectively and making better choices overall. That's when we start to step them down. So it's not a weekly session, it's an every other week session, and then an every month session to monitor the progress that's being made with the ultimate goal of saying, bye-bye, you don't need me anymore, but you can always come back if you do. And I think that that is really the best delivery of how to explain the getting better process is because people are using their stuff outside of sessions. And that's when you know you're doing okay. And that was a good talk.